Dr. Jamie Taweel, internal medicine specialist and a regular to help us sort out all the medical issues here during the coronavirus. Dr. Taweel, thank you very much for joining us today on the show.
Thank you very much for having me.
You're very patient and waiting through all that.
Yeah.
You look very much like a doctor. You know, you got the stethoscope over your shoulders. That is the quintessential doctor look. You're looking good there, Doc.
Well, appreciate that. I was seeing patients today, so I did have the stethoscope, and I have to sterilize it between each patient, and so it's been an interesting go of things.
It isn't easy, and the hard part of all this, it was easier maybe the first week or two, but it gets harder every day. Do we have to? Oh, we got to do this again. Like we cleaned our studio up on the air as we always do, and we're down to our last Clorox wipe here. We're gonna have to get some more. It's hard, but you know what? Small price to pay all the things that all of us are doing, and you just gotta remember. Just think of your grandma, or just think of somebody else that may be more susceptible to the coronavirus, and everything we're doing is saving their lives, right?
Absolutely. You get that last Clorox wipe. It's got that extra. I heard you earlier saying it's got that extra sauce on it. Goes a little bit more of a longer distance, so to speak.
Yeah, I mean it's downright juicy down there. I mean all of the moisture from the wipes must get right down to the bottom, Tyler.
Yeah.
So tell us about these new treatments and anything new that you're seeing in the field to help combat this terrible disease.
Well, the new treatment that's coming out that everyone's talking about is the remdesivir, which is the antiviral that's I believe originally used for Ebola and SARS. That's been showing a little bit of promise with regards to the treatments and how it's affecting, how it's reducing the length of sickness for hospitalized patients. FDA had just recently approved the release of, or the emergency use of remdesivir for patients that are hospitalized with severe cases. So that is a benefit. The studies are a little bit mixed, and there's still more things that are coming out with regards to that. But from my personal review of things, it looks like it's been shown to shorten the time of illness, kind of like Tamiflu would do for the flu. I don't know it necessarily has enough data to support that it will reduce deaths, but it has been shown to be a little bit of promise, at least to get us in a good direction. So I think things are starting to move, hopefully, to help at least, if anything, reduce the amount of illness to then get patients out safely and free up more resources for further patients that are getting ill.
So with these medical tests, Dr. Taweel, what are you looking for? What is the medical community looking for from these tests to ensure that these possible treatments would be effective for treating the coronavirus or other diseases?
So I'm not quite sure exactly what you're asking. Are you talking about the tests for coronavirus or the studies that are used for the treatments?
The studies for the treatments, my apologies.
The studies for treatments, what they're essentially doing is they're doing a randomized controlled trial. So they're taking patients that have been given this medication versus patients that have not been given this medication, and they're just watching the outcomes. They're not telling which patients who got what. They're double blind, so the patients that are receiving the medicine don't know they're getting it. Patients that are getting placebo don't know what they're getting, and then they just monitor outcomes to see whether or not there's been some benefit. So and then they have to reach what's called statistical significance, that enough of this has been shown to develop a pattern that is statistically significant, that it is a believable study, as opposed to a study that is not, essentially going to give us enough information that more treatments need to be done. So
I saw really good news that remdesivir is going to be offered, I think it's Holland Labs, it's going to be offered free. So that's really helpful. I mean, what a really cool thing to do. You got the drug, and then you're passing it out for free right now. I thought that was a beautiful move. So
yeah, I believe if I read somewhere that the company that creates the drug has basically donated all of it, or at least gotten rid of its entire supply in an effort to try and treat things. Again, with the FDA approving it for emergency use, now hopefully we'll get a little bit more broad use of it. The studies haven't shown any adverse effects to it. So it's not something that's going to be causing significant amounts of bad things, and we're going to get a little bit more of a controlled study for it. And hospitalized patients are the best ones because we have confirmed cases, and we're not just using it randomly on people that have blank symptoms.
So remdesivir is a therapeutic. It is not a vaccine. So we got therapeutics that help people while they have the disease and make it easier to to treat and help them. And then we have vaccines that will prevent the disease. I also saw some really promising news over the weekend on CNN that there's a UK group that is making really good progress on a vaccine. They said they had the vaccine already in progress, so they had done a lot of testing to make sure it was safe to deliver. And they're very optimistic. I mean, no one knows of these vaccines, but there seem to be, in addition to what's going on here in the United States, some real progress being made on vaccines around the world.
Oh, yeah, I think it's a worldwide effort to try and get this as best treated. I mean, I think everyone on the planet has some skin in the game, so to speak. So I feel that I think a vaccine is going to be certainly going to be on the horizon. My personal belief is it won't come out as soon as we're all hoping it will. I think it's going to be some time. It's a process, and it needs to be done the right way. I mean, it's something that every single person will get. That's and so it's going to take some time, and there's going to be a lot of trials. There's going to be a lot of different companies creating vaccines all at once. So hopefully we can just get something sooner than later. But let's just hope that we get it within the year.
That'd be great. The optimist in chief said that we would. The optimist in chief last night on his nationwide broadcast, he said by the end of the year. I don't think I've heard any medical professionals say that, but listen, I'll take some optimism. Let's just see where we end up, and hopefully we'll have something soon.
Hoping for the best.
Yeah.
Hoping for the best. And I think it's going to be a long time. It's going to be longer. Even if it's tomorrow, it's going to be a long time.
No, I get it. I get it. So now, Dr.
Yes.
Taweel, we're kind of in a tough spot. So we're starting to open up. Our society a little bit here in Michigan, and elsewhere around the country, they're doing it more aggressively. I assume the medical community will be watching really, really close to see what happens with the metrics as we start to open things up. And, I just urge everyone in our area to do everything they can to put those face masks on when they're going out, social distancing, wash your hands, all the stuff. But we got to keep a close eye on this. Do you have any thoughts on that whole issue and what might happen? No one knows what's going to happen, but just any thoughts on the caution we need to exert while we're working on coming out here?
Well, I think we're gonna certainly get a bump in things without a doubt, and this is going to come in waves. It's not going to be this peak and then steady decline. I think it's going to be something that we're going to get more. We're going to get bumps. We're going to get peaks and valleys. And it's going to be a bit of a roller coaster, unfortunately. And I think that people will start to really tighten their social distancing once this starts to happen, and start to realize that they can't just be so lax in how they address this type of thing. I think, of course, maintaining social distancing, wearing the mask in public. I'm reopening my office, and we're putting the plan in place. I have patients that are slowly starting to come in. I'm booking them further apart. We got a big whole sterilization breakdown thing, how we're going to have to take the room and completely clean it before we get the next patient in, and we have to close the waiting room. I mean, these are things that patients are starting to have to wait in cars sometimes in an effort to try and to be seen. It's just, these things are a little bit tough. So I think the gradual reopening is, personal opinion as a medical professional, perhaps a little premature. I understand there's various factors that are really pointing to different directions as to why they should open this up sooner. But we're doing the best we can with what we have. So I'm fully,
Dr. Taweel, I appreciate you sharing the story you just did a minute ago about all the things you need to do to get your office open, and we're hearing about that. We've certainly heard the plea from physicians and from surgical centers that they want to get back to doing some of the elective surgeries. People have been waiting in line. They need that medical care, and not the least of which it also impacts their financial ability to continue to do the other things. So you just shared how complicated it is to get your office open. Do you think it's also going to be complicated to get the surgical centers open and get hospitals back in the business of treating non-COVID-19 patients?
Yes, simply put. For surgical centers to open back up and things like that, they're going to have to screen every patient that's going to get an elective surgery, because one positive patient can contaminate an entire surgical team, and now the whole team is out, or the whole facility is going to be under. These are things that really can monkey wrench an otherwise very smooth, surgical suites, hospital surgical centers are such smooth running operations. And so one little thing that's going to just get in the way of that can really, really throw it all apart. So every patient that's going to get an elective surgery and every employee has to get screened going in and self-quarantine, if any positive, self-quarantine until, any positive screening, self-quarantine until positive tests are either confirmed or denied. It's going to slow things down. It's going to definitely also, those surgical centers are built on efficiency and quick turnaround time and are very, very efficient, all the while being completely safe. So now they have to do this even more so. Now, granted, surgical centers are also to begin with, big on contamination. So they're going to be sterile environments. So, but at the same time, they have to just make sure they're not going to bring in someone that could potentially be asymptomatic with positive COVID-19. So it's going to grind it down a bit.
Dr. Taweel, anything else you want to add today? I just appreciate so much you coming on the broadcast as often as you do it. You always have something helpful for our audience, and again, you did today. Anything else you want to add?
No, you always ask me, and I always keep completely blank.
No, that's quite all right. That's because we got to it. We talked about an awful lot today. So
stay safe. And I would just say, I would advise everybody to just be as patient as possible. I mean, specifically, I'm using my own office as an example. It's slowed things down considerably. I spent all weekend, we were hanging plexiglass to make sure that everything is, people are in their bubbles, and please be patient.
All right. Well, it's a new normal. We got to be careful. I think it's great that you're opening your office. I mean, you could have not done that. And all the extra effort that you're going through is greatly appreciated because you can't treat everybody via Zoom, right? I mean, you got to get them in.
And that's tough. And I do have patients that I want, we do offer testing. So I want to be able to do that for my patients. I don't want to just keep sending them to urgent cares and things like that. They want to be able to come here. I know them very well and do it. And agreed, the telemedicine visits are very, very helpful for certain things. I think that's going to probably stick around to a degree. I think patients and physicians, some of them do like it. I personally prefer, hands-on medicine. I like to be able to be in the room with the patient, even though I'm, got the mask on and the gloves, and it's a bit of a nightmare. But some of the things you just need to be able to see the patient. Nothing beats a physical exam as far as I'm concerned.
So are you and other physicians doing COVID-19 testing in your own office? Is that what I heard you say?
Yeah. So I'm working with local labs that offer the test. So now I'm able to get the testing, get both the antibody testing as well as the nasal swabs, and send them out and get my results within a day or two. So I'm able to offer testing through labs.
And is that happening widespread, or is this something that you have been able to uniquely do? Could you talk about that?
No, it's getting a little more widespread. Most urgent cares now offer it, so it's able to, as most labs now have the technology, they started to get a little bit more on board. Local labs, that is, they're able to contract with local facilities. So most of the local places should probably be able to get it taken care of.
And for you to have a test with one of your patients, what are you looking for from them? Are you now in a position where you could just test anyone who walks into your office?
No. The governor basically allowed for certain types of testing for certain people in terms of people that don't require any symptoms to get tested, like food service workers, healthcare workers, things like that. People, basically essential workers. But if a patient comes in and has very, very specific symptoms that are going to be, cough, shortness of breath, fevers, chills, things like that, then we're going to be able to we're going to be able to test them, or known exposures. So if you've been around someone or you're at work and you had someone that had an exposure, anyone that's going to benefit from knowing their results so that they can self-isolate and not spread this further.
All right. Well, let's keep in touch. Thank you very much. Do you want to share your information? You've been so kind. I've not let you plug your practice here. You want to give people your telephone number or your website or anything?
Of course. I'm grandrivermedical.com, all one word. And the phone number is 248-264-6169.
All right. Hey, I'm getting pretty good with my head thermometer. We've got one of those here in the office. I pass the test every time, but we're using that every day, and we were able to get one, which was amazing enough. So,
we're doing it for every employee that comes in every day.
Yeah.
So
we're doing our part. Thank you, Dr. Taweel. I really appreciate it. Thank you for joining us again today.
Thank you so much. Have
All
a
right.
great day.
You too, Dr. Jamie Taweel, joining us.